Hi, this is Pete Fernbaugh. Welcome to Trinity Talk. My guest today is Andrew Henry. He's Health Commissioner for Jefferson County, Ohio. It is so good to have you here, Andrew. Thank you so much.
Thank you, Pete. Thanks for having me.
Absolutely. So first of all, before we get into the work of the Jefferson County Health District, let's get into your background, how you came across this career, how you got into this line of work.
So I've been working at the Jefferson County General Health District since 2021. Prior to that, I was actually working at Trinity Health System as a practice manager. So I managed physician offices, particularly primary care towards the latter half of my time here. But the position opened up really right in the middle of the COVID-19 pandemic.
I was going to say 2021 is quite a time to become health commissioner.
I had started right whenever the vaccine was going to be deployed.
Okay.
So started in January 21 and really hit the ground running then. But yeah, prior to that, I was an employee at Trinity Health System.
Okay, well, welcome back.
Yeah. My experience, I have a master's degree in Health and Human Services.
Okay,
so
gotcha.
Graduated from West Liberty University in 2013 with a bachelor's in Health Services Administration. Started working down in Wheeling, actually at Wheeling Hospital for their residency program. Then came up here to Trinity and started working in IT while I was working on my master's degree in Health and Human Services. And after I finished that degree, got promoted to be a practice manager, and then the health commissioner job opened up and I had the qualification, so I put my name in the hat.
Terrific.
Yep.
My alma mater is West Liberty as well.
Okay, yep, and YSU, Youngstown State, so we're happy to have them come to Steubenville. That's where I got my master's degree.
Yeah, there are a lot of partnerships going on with YSU right now, which is great to see. So tell us about the Jefferson County Health District. I think, as we were talking about before we started filming, we lay people don't fully appreciate all that you folks are responsible for in a day's time. So let's start with the background for health districts. Started with legislation as far back as the 1890s. But give us a little bit of an overview before I try to regurgitate it in a very haphazard way.
So in the later half of the 1800s, Board of Health were established by the state of Ohio. Each county had to have a Board of Health. Fast forward to the Spanish flu that happened in 1918, obviously a pandemic in and of itself. So the state saw a need to really bolster public health after that. So there was a law enacted in 1919 that required each county or municipality of 5,000 or more to establish a local health department. So public health dates back to the I'll say early to mid 1900s, depending on when that health district actually got established and got their boots on the ground. So public health in Ohio has been around for over 100 years. And it really started with just the bare bones of having a health commissioner and a nurse to ensure that we could provide disease prevention and vaccines. And then as you saw time progress, it got a little more, I'll say, social aspect of it. You know, you had CMS. Medicaid services were started, which also included Medicaid back in 1965. So you really saw that expand to some of the social side, providing resources for people. And then as well as WIC was established in 1972. So you really started out with the bare bones minimum of disease prevention, and you've seen public health grow ever since.
And now you're into environmental aspects.
Yes.
And you have community outreach programs, which we'll get to. Really, the broad range of responsibilities would be staggering if you actually sit down and look at it, and especially for, as I said, a layperson like myself, to step back and realize all that the health, because it's easy to rag on the health department. It's easy easy to complain, as I'm sure you know. Right, your government, yes. But you really do have a wide purview. Now, at some point, they established health districts, right? And that was for more mid-sized communities.
Sure. So what we had originally in the 1919 law was that each city, so if you were a municipality and you had more than 5,000 people, you constituted a city health district. Then the outskirts, countywide, townships, villages, constituted a general health district. Over time, we've seen that really evolve to more of a regional approach, to where the city of Steubenville and the city of Toronto contract with us to provide public health services for them, so they don't have to have health departments.
Gotcha. Interesting. All right, so that's an interesting background. We don't think about there being a time when there wasn't a health department.
Right.
We don't think about And I mean, it makes sense because this area is so urban and rural. So you really need to have detailed legislation to deal with a very diverse demographic of residents. So what would you say your chief day-to-day responsibility is? Let's start there.
Yeah. So my chief day-to-day responsibility is oversight over our various departments. So we do have our nursing and community health department that does both clinical and community outreach type of events. We do have vital stats, which is where people come in and they can get a birth or a death certificate, and the environmental division, where they have a huge spectrum of responsibilities from landfill oversight to pool inspections. So food license, anything you can imagine that requires a certificate to operate from a health standpoint is going to come through us at the local health department standpoint through environmental. And then we also have our WIC department, which provides those nutrition supplement for children up to 5 years old. So overseeing those departments is a huge part of my responsibility, but also being that I am our public information officer.
Right.
So when you're the health commissioner, people are always wanting to hear your opinions on things. What are the facts? So that's a huge part of my responsibility as well.
So you handle a lot of PR, a lot of media relations, and that sort of thing. What are some of the challenges the district is facing right now?
Yeah. As with anything governmental, funding is a huge challenge for us. We are a non-levied health department, which there are very few still left in the state of Ohio. So we rely solely on township apportionments, so funding from our townships and villages, as well as contracts from our cities. So making sure that we're having adequate funding to provide the essential services public health is expected to provide is always a challenge. And whether you have levy or not, funding is always going to be a massive issue. And I'm sure healthcare, from my experience in healthcare, it's no different there.
Right. Do you have to rely on any grants or anything?
Yes. So we're always very proactively applying for grants to provide those different, I'll say, community benefit type services. So for example, we're working right now with Trinity to apply for a rural health grant to ensure that we are addressing chronic disease in rural communities. So those are the types of things we're always trying to work on to find better ways to achieve the goals in our community health assessment.
Right. Now, from a health perspective rather, when you look at our communities, what are the health challenges that you're confronting? I noticed when I was going over some of the material you sent me, you do a lot of distribution of Narcan.
Yes.
So I would assume the drug epidemic, we all know that's very potent here.
Yes. So thankfully, we actually have seen the number of fatal overdoses in Jefferson County decrease over the last several years. So we are making positive strides on that. I'm not going to say we won't have a span of a couple months where there is a bad batch of drugs circulating in the community that is causing fatalities, which is then when we are really proactive in trying to get that naloxone out to the community. So certainly it's characteristic of Appalachia in our community, in our region, really, to have some opioid struggles, and we certainly have those. But from I'll say a non-mental health or substance use standpoint, we have a lot of struggles with hypertension, diabetes, and a lot of that comes from a lack of a healthy lifestyle or the inability to access healthy foods, making sure that you're getting adequate physical fitness in a given day.
I would imagine that the poverty rate, which is pretty bad in this area, also influences a lot of those issues. So what do you do to confront that aspect of the area?
So certainly being, I'll call it the Rust Belt of America here, obviously the economy is not as strong as it once was. So we definitely are working with different agencies. Obviously we have the WIC program that provides those nutrition resources and the funding to go buy healthy foods for those families who are struggling economically. Always have a great relationship with our food pantries. We are working with the Urban Mission. Sometimes we'll go table at their food pantry and provide resources to people. So they'll provide food and we'll provide some health services If it's Heart Month, we'll go provide Heart Month education at the Urban Mission or other areas throughout the county. So we do try and work with those different agencies that are really providing those day-to-day services for the underserved populations.
Interesting. So education then, I know at Trinity, education's a huge part of our community outreach. Urban Mission, huge part. Just about every community organization I've talked to on this podcast, community outreach is paramount to their mission. So, and education. So tell us a little bit about your education efforts.
Yeah, so we will attend health fairs when we're invited. We'll attend different, I'll say, grassroots organization events, whether it's a senior center, a local club such as a Kiwanis or the Lions Club, and provide updates on what's going on in the community. So we want to really get out and educate the community. And we'll also work with the library. They're a great resource because they have so many branches throughout the county.
Yes.
So we try and set up shop there a couple times a year, especially like, as I mentioned, if there's a particular health issue that is prevalent, we'll try and do some outreach. Like I said, naloxone, flu shots. We'll go out to the community, provide flu shots at the different library branches throughout the fall. So really try and be out in the community, try and be visible to let the county know that, hey, our home base is in Steubenville. It's the county seat, but we also know that we are responsible for the entire county.
Right. How many residents approximately are you accountable for?
Yeah, so there is just under 65,000 residents in Jefferson County. So we are responsible for all of them, everyone from newborns all the way to our geriatric population.
When you're dealing with, let's start with the geriatric population. You mentioned hypertension and some of the other issues that are characteristic of that demographic. How do you seek to educate and how do you seek to reach out? Because what you're doing, it's governmental, but it's also a ministry in a way.
Sure.
So how do you seek to reach out to the elderly population?
So whenever an organization is having an event, as I mentioned, if it's a senior center, there's Our Place, there's Prime Time, and Our Place also has other locations that they help get started from a senior services standpoint. So we try and get out to those organizations whenever we can. The YMCA in the past has had their senior health fair. So we really try and get out to where we know that people are going to be. Obviously, you have like the Silver Sneakers at the Y. You know that there's going to be people there on a weekday morning from 9 to 11 a.m. Playing pickleball. That we try and go where we know people are going to be, because one of the most difficult things with outreach is knowing that if we go to a rural population, we'll say Adena. If you go to Adena, you may see 5 to 10 people in several hours. And that's just recognizing that population is smaller. And if you can reach a handful of people, you did your work for the day. Now, if you are in the downtown Steubenville area, north end, south end, wherever it may be, you may see 50 people in just a couple hours, but that's obviously given the population size. When
it comes to newborns and infants, what are some of your, and preschoolers, what are some of your outreach efforts there?
So obviously we have our WIC program, which is very important. It provides that supplemental nutrition. We also have the vaccines for children program. So if somebody is on Medicaid, so if they're uninsured, underinsured, we can provide vaccines for those children to keep them on schedule with their vaccine. We also provide education in the schools, so we'll provide dental education. I want to say in 2025, we provided 830 students in kindergarten and preschool with dental education. So it's very important for us to get out. And then if there is funding available through the state health department for certain, I'll say, health issue education, we'll try and apply for those grants to be able to send our nurses out too.
I don't know why it's such an underappreciated aspect of what health organizations do, but really education is, you can offer the services, but without all of these educational programs, those services can fall flat. People don't realize how much they need them. So are you always looking to innovate on those educational services?
Yes, so we're always trying to bolster our education services. So for example, we give out car seats. It's called the Ohio Buckles Buckeyes programs. We gave out nearly 60 car seats last year in 2025. So clearly there's a need in the community.
Absolutely.
But it's one thing to give somebody a car seat and say, here you go. But it's another thing to educate them on how to put it in correctly to make sure that the kids are safe.
You saw Fantastic Four last summer. That was the tag scene. They were trying to figure out
how do I put this thing in? Well, let me show you.
That's great. And that's not something I would think about. It's like, oh, great, you're giving them a car seat. okay, I'm not sure I know how to
Yeah, right.
put it in. What are some other educational avenues that you provide?
Yep, so we have the Cribs for Kids program. So we provide pack and plays for families who are, once again, income eligible. If they're struggling to find the resources to get a crib for their child, we can provide them one. They get safe sleep education to make sure that their child is sleeping properly in their crib. And then they get to be able to take a pack and play, which is great because it's mobile. They can take it if baby's staying at grandma's house, they can load up the pack and play and take it over. So those are other things we do. In the past, we've done lead education. We have a lot of older homes here in Jefferson County, so ensuring that people are cleaning their house properly, getting rid of old lead paint, painting over those walls, and making sure that they're cleaning up any lead dust in their house is important too for kids' health.
I would also imagine that when it comes to restaurants opening, the buildings are so old. There's probably a lot to be aware of in that. That falls under your purview as well?
Yes. A major undertaking that some people don't always understand the process for. So coming to us is a great place to start because we are going to give you your food license to operate.
Right.
But prior to that, you need to make sure that your building is following code, which will go through either the city of Steubenville or typically the Department of Commerce if you're outside of Steubenville, because our other municipalities and townships, villages don't have building departments.
Right.
So once again, a big education piece of making sure people know start to finish, how do you even really open a restaurant and do it the right way?
Right. Right. It's just incredible how much it does take to keep a village or a city running safely and to allow people to just come and go as they please. And I appreciate so much of what you guys do. Sure. You have a couple, this may be released after some of these events have happened, but what are some of the events you have coming up this summer? Yeah,
so we have several events coming up. We have on Friday, June 12th, we're going to Austin Lake. Austin Lake is campground in Jefferson County.
It's a beautiful place.
Yes. So we are going to be providing just general summer safety education and resources. So we'll be providing sun hats, we'll be providing bike helmets, and things like that to help foster a healthy, safe summer for people.
Yes.
So we're doing that on June 18th. We're doing a safe sleep event at Beatty Park. So we'll be able to give out pack and plays and some other safe sleep resources to families. So that's once again June 18th, first 50 families, Beatty Park.
Excellent.
Another event at Beatty Park that we help is for the Dino Dash, the Dean Martin Festival.
Right, yes.
Big festival here in the area. So we help coordinate the Dino Dash. We got close to 70 people signed up for that, so they'll be testing their fitness on the trails at Beatty Park, so we're excited for that. And then we do have, so this is where I can tell you how broad of a department we are. Coming up in September, we have a training through Rural Domestic Preparedness Department for isolation and quarantine for rural communities. So if you are, say an EMT in a rural community, you'd like to learn more about it. If you're a nurse here at Trinity and you'd like to learn more about isolation and quarantine, we do have that training coming up in September.
Okay, those are all terrific programs. I want to circle back to, I hate that term circle back, but I use it anyway.
That's okay. We'll go back there. Yeah.
I want to talk about this partnership you have with Trinity Health System. So explain that a little bit more.
Yeah. So one of the biggest partnerships we have with Trinity would be through our community health assessment. So both organizations, Trinity and the health department, are required to do a community health assessment and do it together to ensure that we are pushing the community in unison and in a direction for health.
Excellent.
So every 3 years, we dust off the old, I'll say, Outlook calendar and say, okay, we got to get back together and make sure we're doing our community health assessment. So definitely don't dust off that community health assessment. It's an active breathing document. We use it.
Gotcha.
So we'll assess the health of the community. I want to say in our 2025 community health assessment, we surveyed over 400 Jefferson County residents on various topics related to health. And then also had roughly 20 community partners from different like agencies who have a hand in the health in the community and did community partner surveys for them. Then after that community health assessment is done, we take all that data and come up with a community health improvement plan.
Yes, I've seen those. They're very interesting to look through. Now, what are some of the areas, just a few final questions here, what are some of the areas of health in our area that you have noticed improvements on, marked improvements?
So I want to say access to me is an area that we've seen great improvement
Terrific.
on. In our community health assessment, 80% of the respondents actually said that they had a primary care physician, which is great.
That is amazing, yeah.
Right, because a lot of times we'll hear that there's a lack of access for primary care. Now we still need to work on those 20%, those individuals that are using emergency services as their primary care service. We need to increase access specifically, like for example in Steubenville's North End. There isn't a primary care physician in Steubenville's North End, and they have a pretty large population that is through the Jefferson County Metropolitan Housing Authority, government housing. We need to make sure that those people are able to access primary care when they need it. There is some primary care in downtown Steubenville. I know Trinity has the office at the Chase Bank building, and there is the Ohio Valley Health Center that serves the south end of the community. And really, they serve the entire community.
Right.
Anyone in the valley that needs healthcare services and doesn't have insurance.
But they're the most prominent.
Yes.
Town.
But really need to grow primary care there and really kind of get the word out with a lot of the health services that are available in the community. I know the Jefferson County Resource Network has done a lot of great progress as far as it relates to getting all the services, health services, social services that are available in Jefferson County on a website so that we can point people to that website and they can find all the services they need.
That's terrific. And mental health, how does that stand here in the
so some progress we've made on mental health is the fact that we've recently started a suicide fatality review committee. Really, it's an unfortunate, sad term to say.
Absolutely.
But it's really important for us to, at the end of each year, to kind of take a step back and say, okay, if we've had a dozen suicides here in Jefferson County, let's look at these individuals, look at the case by case, and say, what could we have done different to help this individual through their tough time? So we're really trying to peel back that onion and figure out what are the prevalent issues that are causing people to take their life.
Sure. That's a degree of vigilance that is most needed. Yeah. Especially coming from a generation where that is so prevalent now.
Sure.
So, anything you'd like to cover that I didn't give you a chance to discuss? I'm sure there's a lot, but
yeah. I just think, so public health to me is one of those services that largely goes unseen.
Yeah.
It's one of those services that you expect to be there when you need it, but you also want it to be kind of in the background when you don't need it. For example, we're always in the restaurants, as I've alluded to, but beyond restaurants, our environmental department does a fantastic job ensuring that our parks and our camps are certified.
Right.
Pools. Obviously, waterborne diseases are a huge issue, so we want to make sure that our pools here in Jefferson County are operating up to par, as well as even a tattoo parlor. Some people may not know that tattoo parlors, you can't just stand up at a tattoo shop. You need to follow the proper protocols. So our department does a great job from environmental through WIC to nursing, and proud to be part of it.
Excellent. Well, Andrew, thank you. I don't know how you ever get a good night's sleep.
Yeah, I try. It's my kids. They wear me out. So
that's right.
Yeah.
And then we wear you out.
Yeah.
The public wears you out.
Sure.
No, but thank you for all you're doing to manage our health, to inform us about our health, and to provide services for those who may not have the access they need.
I appreciate it, Pete.
And thank you for being here on Trinity Talk.
Absolutely.
Absolutely. Thank you so much, Andrew, and we will see you again next time. Thank you for watching.